So good afternoon. Welcome to the program of the Department of Integrative Medicine. Today we are lucky to have somebody who has come from, although she is from here, she did her MD in psychiatry from Nimhans itself. She has now gone to the US and really has a passion for functional medicine, as it is called there, which includes Ayurveda as one major component. And she is going to sort of enlighten us how the practice of functional medicine she is carrying on there. She basically is an MBBS from Bellary Medical College and the psychiatrist from here, after which she went to the US, and as her bio has been circulated, most of you will know what she's been doing in the last maybe 15 years. So in the last, particularly in the last 8 years after she completed her diploma, what is it called? Integrative and holistic medicine. She also did a special study of Ayurveda, although as she says, her Ayurvedic understanding is more sound in terms of the physiology and the not so much the botanical side of Ayurveda. So she has a person with MD Ayurveda background working with her. And we are very interested to learn from her, Dr. Aruna, about how it is to practice in a kind of holistic manner. What there it is called as functional medicine. That terminology we don't really use here. So maybe you would enlighten us what really functional medicine is. The terminology is one of the things that people get bogged down with. What is integrative medicine? What is functional medicine? What is not integrative medicine? So I'm very happy to introduce Aruna to all of you, both people who are here and those who are online. I'm happy to see Dr. Geeta Desai and Dr. Tally also here. Welcome to all of you. And without much ado, I would request Aruna to go ahead.
Thank you, Dr. Shivaram. Good afternoon, everyone. Namaskara. First of all, I am really indebted for this opportunity. Nimhans has been, I consider Nimhans as the training ground where everything that I am today, it really was shaped in these grounds. And so Nimhans has a special place in my heart, and it will continue to be so forever. So coming here today and speaking here, having this opportunity in this department is a dream come true. So as Dr. Shivaram was saying, I did graduate from psychiatry here, and what the foundation of psychiatric assessment that I learned here is the biopsychosocial model. But when I went to the US, people actually have moved away, unfortunately, from that. It's primarily a biopsychiatric model, but even there it's just the chemical imbalance theory that's primarily followed, and that is where I found the first disconnect. I mean, I have a story to share. On my very first day as a junior resident here, I forgot my knee hammer and stethoscope. It was back in Bellary, so I didn't evaluate my patients with a complete neuro exam. And I was made to be so scared by the senior resident of my unit that without a neuro exam, none of my evaluations were completed, and I was in for a scolding. And truth is stranger than fiction. My first day as a psychiatric resident over there, I bought a new litmus stethoscope, I bought a new fundoscope, and everybody knew I was a practicing psychiatrist from India, so the attending over there asked me to evaluate the patient. And when I started to do that, after the interview portion, I started to get the stethoscope and the fundoscope out, and the attending said, "What are you doing?" I said, "I'm going to rule out neurological causes." And he said, "No, you don't touch the patient here." So I was like, "How do you rule out organicity?" And he said, "We have an internist. It's medical legal liability to touch the patient." And I'm not, this is really what happened to me. The contrast of first day here and first day there, again, truth is stranger than fiction. But then, I finished my residency, and I was always interested in the interface between neurology and psychiatry. So I chose to do fellowship in geriatric psychiatry. And then I started my private practice for a local hospital. But by then, I think many of us in the field of psychiatry, it's learning psychiatry and psychopharmacology is not a big deal. Within a few months, it's a handful of diseases. It's depression, anxiety, and psychosis, bipolar, schizophrenia. It's just OCD. I mean, it's just the same thing. And for all of this, the underlying hypothesis is that there's a chemical imbalance. If it's depression or anxiety, you give antidepressants, maybe some anti-anxiety medications. And if it is psychosis, you give antipsychotics. But by the time I started private practice, I had this jaded feeling that what I'm doing is not really helping. And I think many of us do recognize that, the side effects, the relapse rates, that people don't really recover. And we are taught in psychiatry that this is how it is. We don't understand mental illness. We don't know how to cure it. The most that we can do is manage it. But to my pleasant surprise, when I entered into integrative functional medicine and Ayurveda, I found that there is a whole body of knowledge that has been existing for thousands of years across the world, not just in India with Ayurveda, but also in Europe with homeopathy, naturopathy, which I think originates from the US, chiropractic medicine, Chinese medicine. Every culture had its own indigenous form of medicine, which really talks about the innate healing ability, that it recognizes that our human mind-body system is a self-contained system. And when there is a breakdown in the function, all we need to do is to implement that innate healing abilities. That is how health is created. So this was a mind-blowing experience for me, and this happened in 2013 is when I went for my first conference in integrative medicine. And the information that was presented to me was so inspiring. Right then and there, I decided to change my practice. And the next 2 years, from 2013 to 2015, there was a period of rapid education for me and learning the different modalities. And I chose functional medicine and Ayurveda because they're very similar. And I ended up trying to practice it within the hospital setting. But the whole system there, especially in mainstream psychiatry, was very antagonistic to the ideas that I was presenting. So that's what prompted me to start my own practice in 2016. And I'm very, very pleased with the work that I do. We see real recovery and remission in many different psychiatric diseases. Also with chronic other diseases, whether it is diabetes or autoimmune disease, IBS, Crohn's disease, many of these conditions we are able to bring about healing and remission. So that is what I'm hoping to share today. So I have used some slides with permission from Institute of Functional Medicine as well as from Maharishi Ayurveda, and I did go over mine. So what we're going to go over is really understand the limitations. I'm not going to spend too much time on it. I think anybody that is practicing psychiatry is well aware of that. But I do want to jump into some patient examples and talk about how functional medicine and Ayurveda and look at the genetics, microbiome, and how it all comes together. And if time permits, we'll talk about that. This is hyperbaric oxygen therapy is the latest thing, and that I've introduced in my practice. It's as recent as 2 months ago. I don't have my own clinical experience, but the literature evidence is pretty convincing that we should all, especially in the neuropsychiatric field, we should be looking at hyperbaric oxygen for neuropsychiatric diseases. So mental illness is a condition that affects every culture, every society in the world. In India, I think the rates of mental illness are about 14.5%, pretty high. I do want to bring everyone's attention to rates of autism. So in the 1970s, this data is from CDC, and this pertains to the United States. So in the 1970s, it was 1 in 10,000. But today, 2021, it is 1 in 44. It's an astronomical increase. Now, when you look at India statistics, 1 in every 60 children. This paper article was published in 2019, and this another paper article says that autism cases are rising in the last 2 decades. Now, the common response to this is that it's genetics or it's better diagnosis, better classification, better training. But really, especially in the US, from 1 in 10,000 to 1 in 44. Can that be simply explained by genetics and all those other factors listed? Can genes change in a matter of seven decades? It doesn't. It we really have to bring into question about the lifestyle and the rapidly changing socio-environmental conditions that we are being exposed to. So this is one of my favorite quotes, because in order to seek truth, it is necessary once in the course of our life to doubt as far as possible of all things. René Descartes said this. He's a famous French philosopher. Unfortunately, he's also the reason why there is mind-body dualism. Yes, but if you actually read his works, he wasn't really trying to separate the two, but the interpretation of that his work has definitely affected the mind-body separation as it is practiced in Western medicine. So with this, everything that I'm presenting today, please do not take it at face value. Question me, do your own research, everything. We have to. This is the first patient I actually saw him. He was one of my very first patients in 2016 in my private practice, with whom I had the liberty of applying the functional medicine Ayurvedic model. He was a 34-year-old male patient seeking treatment for depression, anxiety, and attention deficit. These were the diagnoses he was given. He had been in treatment for almost 17 years with many different psychotropics and on and off psychotherapy. He was not able to progress in academics despite being a very, very bright student. And he was struggling with ongoing depression. And at that point in time, he was working as a manager at Starbucks. And there was definite genetic motive of anxiety and depression, history of allergies, asthma, hives, gut issues. This is as per my evaluation using functional medicine. We do a complete life story. And I found all of this had happened. And then I also found that right before he came to me, 6 months before, he had history of repeated strep throat, for which he was given multiple antibiotics, which ended up in him developing C. colitis and ended up in the hospital. Coming out of that episode is when his anxiety and depression had severely worsened. So when I saw him, he was anxious, depressed with obsessions and compulsions. I also wanted to present this second patient. I saw her in April of 2020. 31 years old female patient seeking treatment for schizophrenia. This was her official diagnosis. She had received treatment for up to 7 years with mainly antipsychotics, including 2 inpatient stays. She would experience some amount of remission with the symptoms while she was on the medication, but young woman, 31 years old, she had gained 40 to 50 pounds, did not like it at all. So she discontinued that, I think, in 2019. And within a few months, towards the end of 2019, she had a relapse in her symptoms. So but this time she didn't want to go down the same route of medications. She found me online and she came to me. So when I saw her, she looked very much like what we associate with psychosis. She was quite disheveled. Even her dressing style was not put together. She was very anxious with paranoid delusions and auditory hallucinations. But what struck me was a severe rosacea that she had over her cheeks and nose. And she also had obsessions and compulsions. This is her before treatment. On the left side, that was the picture that she had taken, actually while she was on the antipsychotics. You can see her face is a little puffy. She was quite overweight with the medications at that point in time. The second one was right at the time of starting treatment with me, or maybe within the first 1 month. So her labs are only mentioning the birth and bonds. Her HSCRP was 2.2, lipoprotein A, which is another marker of inflammation that I like to follow. I also look at ESR, but not everyone is positive for all of these things. Lipoprotein A is very high in her. It should be less than 75. And this is not only a marker for inflammation, but it is also a marker for cardiometabolic risk. And then thyroid peroxidase TPO antibody, that was 303, which is again, it should be less than 10. So it's severely elevated. So what would be the standard psychiatric practice? What we do is we offer psychiatric medications. In the first patient's case, it would be antidepressants. In the second patient, it would be antipsychotics, maybe also antidepressant because I actually identified she's having OCD. Then maybe psychotherapy, including CBT and ERP, and then maybe, this is how it's practiced in the US. Other modalities like maybe we might say yoga or some other modalities, some stress reduction meditation is very big now in the US. So, but the bedrock of intervention is still with psychiatric medications. So the question is that really helpful? So let's look at, this framework is so prominent that as of today, 13% of Americans over the age of 12 take an antidepressant. This is over the age of 12. This is the most, these statistics are as recent as 2020. So 1 in 6 adults take at least one psychotropic, 80% of them chronically. And over a span of 20 years, antidepressant use in the US has increased nearly 400%. So looking at all of this, one would think, because antidepressants are supposed to be treat depression, reduce suicidality and all of that. But if you actually look at public health statistics, what are we seeing? Depression and anxiety is at its highest, especially in the young adult population. Suicide rates are at its highest. I think it's at 25% in the young adult population. 25% of American youth are committing suicide. So there is a disconnect, right? On the one hand, we seem to be grabbing everybody with depression and treating them, but on the other hand, we are seeing that it is not really helping. And let's take, I just talk about STAR-D here, but whether we look at KD trials or STEP-PD, the outcomes seem to be the same. One, that these medications don't outperform placebo in the real world. And number two, many patients don't stick with it because of the side effect profile. And long-term outcomes don't seem to be really helping these patients. Then why? With regard to treatment of psychosis, this is next paper. In this study, what they found is that early dose reduction and discontinuation is better in terms of functioning and also prevention of relapse over a long-term follow-up of 2-year trial. So typically with many medications, we see that the maximum follow-up is for about 12 weeks. Nobody has really looked at what is the, what happens in terms of socio-occupational or emotional functioning after that. There are, non-pharmaceutical industry funded studies are looking at this, and this is the picture is very, very diametrically opposite. This is another study. Martin Harrow is actually a psychologist based out of Chicago. He has been doing a lot of studies with antipsychotic medications and outcomes with schizophrenia. And basically what he has found is that patients with schizophrenia not prescribed antipsychotics had significantly better work function. But those that are prescribed antipsychotics actually end up more on disability, on Medicare and Medicaid. And their socio-emotional functioning, relationship-wise, is also they don't do that. So something is not gelling right. And then this is a study that came out in 2018. So atypical antipsychotics, insulin resistance, and weight, and they actually looked at it in healthy volunteers. And basically what they found that even in healthy volunteers, so basically metabolically normal people, insulin resistance can happen in less than 13 days. And weight gain can happen in less than 1 month. Now, psychiatrically ill patients are at high risk for metabolic diseases. So imagine what's happening with them. The reason why we're struggling like this is because we really don't have a framework to understand mental illness. And psychopharmacology has repeatedly overpromised and underdelivered. And we go through it with every new, with Rexulti, I don't know the generic names, but Cariprazine, the newer antipsychotics we see. I've seen really horrible akathisia and withdrawal emergent akathisia with all of these newer agents. So I am really afraid to start any of these new medications. And the side effects. So, look at this. We were told that it's okay to create diabetes because we are going to have a modest control of the secondary symptoms. How is sacrificing one organ system to cure another? How is that creating? But because we don't know any other way, then it makes sense that we don't have anything else to offer. It's okay to do this until we learn a better way. Maya Angelou, she's a writer, very famous Black writer. She has said, when you know better, you do better, and that is my hope as well. So psychiatric diagnoses are based on an atheoretical system of symptoms and signs. At least in ICD-10, I know the first section is organic diseases, right? Because it's ingrained in us that we first have to rule out organicity and only then functional psychiatric diseases. In DSM 5 and 4, that is not there. So there is an intermingling. The idea that you have to rule out organicity is really not taught. And then what we do is we match the pills to the ills. It is actually symptomatic treatment. We try to suppress symptoms, but there is no understanding about what is the underlying root cause. So what really prompted me to look into food as medicine and into holistic medicine was this study that came out in 2015. There was actually another study that just talked about the difference in the outcomes at the end of 1 year. So this 2015 was after 5 years. So this is what they're looking at in giving omega-3 fish oil to 40 patients versus 80 patients who were all high risk for psychosis. 40 of them got omega-3 and 40 of them received a placebo, and it was only 12 weeks intervention of 1.2 grams of omega-3. And at the end of 12 months, only 4 of the omega-3 group versus 16 of the placebo group had psychosis. And at the end of 5 years, which is what this study is, these improvements actually sustained. And omega-3 group were functionally better, and across all indices, omega-3 group was better. So I knew that we needed to move away from this, and it is this idea that we can do more in terms of diet and lifestyle that I became interested in integrative medicine, and the path really opened up for me. So what is integrative or holistic medicine? It is that we use everything that we have in our toolbox. So I'm not that way. I know one of the main criticisms back in the US is that I'm anti-psychiatric. I'm not. I may be anti-psychopharm. I'm actually not anti-psychopharm. I would say that I like to use everything in the toolbox with the risk and benefit analysis really being the guiding factor for what I choose. But in integrative mental health or holistic mental health, we always try to look at the root cause, and it is different for different people. It follows the biopsychosocial model, but the bedrock of intervention is actually diet, nutrition, and lifestyle. Functional medicine, this is it's from the Institute of Functional Medicine. This is actually the fastest growing modality in integrative medicine in the US. They are very operationalized, they're very organized. And Institute for Functional Medicine is actually trying to transform medical education, starting with undergrad medical education, which is very, very hope-inducing. So functional medicine understands that the underlying causes of disease need to be addressed using the systems-oriented approach, which means that no matter what the presenting symptoms, it could be diabetes, it could be depression. We have to look at the whole mind-body system. And treatment can only happen in the medium of the therapeutic partnership. So it's not placebo effect, but it's actually very, very important to have that therapeutic relationship. Functional medicine is a new way of thinking in addressing health problems, whose philosophy derives from Ayurveda and Chinese medicine. So this is the main tree graphic that they use in functional medicine to depict the mind-body system that is our human body. So the leaves and the branches is where modern medicine is. It's all about organ system diagnosis. That's where we see all the different specialties in medicine. And signs and symptoms are a little below that. But in functional medicine, what this institute does is that instead of looking at the body as made up of different organ systems like gastrointestinal respiratory system, they've actually reorganized the whole human body into different functional systems. For instance, under assimilation, it includes digestion, absorption, microbiome, and GI. But under like communication subcategory, it includes endocrine system, neurotransmitters, immune system, as well as cognitive function. So as you can see, they're not going by anatomical breakdown of the body, they're going by the functional breakdown of the body. And then we are taught to look at the root of the tree, which is made up of very basic life factors, which is what kind of food we are eating, what is our social environment, relationships, are we experiencing any trauma? These are the things that we need to focus on when we look at evaluation as well as intervention. So this is, so when I did my training with functional medicine, I was taught to evaluate a patient's story up until the point from their birth, probably even preceding their birth, till the moment they come to me with this framework, antecedents, triggering factors, mediators, and then also try to understand what are the functional systems that are not functioning well. So for instance, for most psychiatric patients, we find that their assimilation, which is mainly digestion and absorption, that is not functioning well. Immune system or defensive repair is not functioning well. Energy system is not functioning well. Detoxification. So as you can see, I find that almost every one of these 7 principles can be dysfunctional in psychiatric illnesses. This is the medical symptom questionnaire. Every patient in my practice has to fill this out. Now, just looking at this is kind of a review of systems from head to toe. Just looking at this, and then in my mind, with my training in Ayurveda, I kind of look at whether they're having a vata imbalance or a pitta or a kapha imbalance. So I do both, but we have very highly esteemed Ayurvedic professionals here, so I thought I'll focus on functional medicine. But in my mind, I'm actually looking at the review of systems, and I know whether, from a functional lens, whether it is detoxification problem or inflammation. From an Ayurvedic lens, I know whether it's vata, pitta, or kapha imbalance. So what happens in chronic disease is that mental illnesses are chronic diseases, and this only results from a disturbed metabolism. So basically a disturbance in the physiology. And lifestyle and environment are the major factors that alter gene expression that results in disturbed metabolism. How do they develop? It's once again, it's poor lifestyle, stress, especially adverse childhood events and toxicity. And the pathway for that is through immune dysfunction, HPA axis, which is hypothalamic pituitary adrenal axis dysfunction, and together that it results in breakdown in basic cellular metabolism as well as overall physiological metabolism. And there is also free radical production because detoxification pathways are impaired. And this results in metabolic diseases, degenerative, immunological, and psychiatric diseases are all of the above. They can be metabolic, they can be degenerative, dementia is a classical example of that. And immunological diseases, almost all psychiatric diseases, in my opinion, arise because of neuroinflammation. This is another way of looking at diseases, is that many imbalances can cause one presentation, a phenotypic expression, but one condition, one imbalance can also cause many different conditions. So this is the timeline that I used to do. And what I began to recognize is that many of these patients, especially with depression, anxiety, and autism, I invariably find that they've had early signs of gut disturbance in the form of colic as an infant. Urine infections is another big factor. So you can go back and talk to your patients. You will definitely find, especially the parents can say, yeah, it was very difficult to soothe this child. They were very, very colicky. We had to give them bright water all the time. And urine infections and other upper respiratory infections. That is the other thing that we see in the toddler age group. Then after that, we see different kinds of anxiety behaviors or GI issues and constipation, diarrhea can happen. But when the underlying issues are not being addressed, then those symptoms go away only to manifest as other symptoms. And in our field, patients present with frank psychiatric diagnosis by the time they're in their teenage years or in their early adulthood. So I don't do this anymore. I mean, it's more mental at this point in time, but I used to do this by hand in the beginning. And so that my first patient that I mentioned, this was how his timeline looked. So basically what I learned is that mental illness is really just a chronic disease. I think I've kind of mentioned it's basically a breakdown in physiology. And then biological individuality is what determines what symptoms or a disease a person will manifest. What I mean by that is, so MTHFR gene, when it is abnormal, it can either cause celiac disease or multiple sclerosis, but it can also be causing depression. What kind of presentation a person is going to manifest really depends on their biological individuality, which is not only their genetic individuality, but also everything about their life and their environment, what kind of parenting they have, what kind of social environment, friends, all of that actually determines ultimately what disease they're going to manifest. So again, so the main pathway for mental illness is inflammation, and I've condensed in the root causes as three main root causes. The diet, in fact, standard American diet is called the SAD diet. It's highly processed, chemical intensive, and has what we call as Frankenfoods, all kinds of chemicals which you cannot even pronounce is present in these foods. They cause chemical inflammation and toxins and trauma, especially adverse childhood events. Tons of information for inflammation to support the inflammation hypothesis. A lot of pro-inflammatory cytokines, anti-inflammatory cytokines are reduced. And especially in cases of autism, studies have shown that there is maternal immune activation, maternal microbiome disruption as well. This is a study that actually looked at a holistic hypothesis to explain schizophrenia and autism spectrum disorders. So I'm going to encourage you guys to go through this. Basically, they found that both in schizophrenia as well as in ASD, immune system problems, inflammation, oxidative stress, mitochondrial dysfunction, all of this is present. This is a slide from the same study. These are all the different factors that can affect our immune system. Iatrogenic factors, many of them. In fact, now Tylenol, which is nothing but paracetamol, has a group of physicians have actually petitioned World Health Organization to remove Tylenol or paracetamol as over-the-counter drug, especially for pregnancy and infancy, because Tylenol can cause autism. That is, I mean, there's studies to support. And then lots of endocrine disrupting chemicals. Since coming here, I've been, both in my home, my parents' home, in-laws' home, everywhere. The soaps and shampoos, everything is brightly colored, pink, green, and then there's a very strong smell to it. All of that is coming from phthalates, parabens. They're all endocrine disruptors. Phthalates especially mimic estrogens. So if you're seeing early puberty girls and boys in India, which is happening in the US as well, if you're seeing infertility issues, they're all because of these chemicals that are so rampant in our countries. And then how did I come to this idea that it's inflammation and that it's toxins that are actually causing inflammation? It's actually not from psychiatric literature, but actually literature in terms of, with regard to allergies and even cancer. There's tons of information that actually connects environmental toxins through the immune system or inflammation pathway to these end organ diseases like allergies and inflammation. And then I thought, if we are thinking of neuroinflammation, maybe this is one of the reasons why we are seeing an explosion in mental illness across the world. And of course, childhood adversity. So this is actually what this slide is basically my understanding about disease in general, but also psychiatric diseases. So bad diet, stress, and toxins, it interacts with us, the human organism. The first step is always disruption of the gut lining. So diet directly, chemicals in our food, the wrong kind of diet, it disrupts the gut lining. Stress through the HPA axis, cortisol is highly toxic to our gut lining, and toxins directly destroy the gut lining. And when that happens, inflammation sets in as undigested food and toxins triggers the immune cells, that is the Peyer's patch and intestinal wall. Inflammation accumulates and eventually spills over. And when these inflammation molecules reach various end organs, that is where we see the disease manifestation. So it could be rheumatoid arthritis, or it could be depression, or it could be MS or migraines. This is a really good article that actually has compared Ayurvedic etiology of major depressive disorder and bidirectional affective gut dysregulation. This is the slide that describes what happens with leaky gut. And then leaky gut results in leaky brain. So the lower half of the slide shows how the same process that's happening in the intestinal wall is also happening within the nervous system. Another slide to describe what exactly happens in leaky gut. Alicia Fasano is a pediatrician who's done a lot of research, and basically what he says with regard to celiac disease and leaky gut, what he says is that gut is not like Vegas. What happens in the gut does not stay there. It can cause every disease known to mankind, which is a very, very old concept from Ayurveda. So leaky gut can cause IBS, Crohn's, ulcerative colitis, depression, colds, food sensitivities. I mean, so many of my friends and family here in India have been telling me that they're having so many different allergies to different foods. It seems to be exploding. They were not born with it, but now as adults they're developing that. This is most likely what's going on. Here's another patient. It's a 6-year-old boy with autism, actually of Indian origin. He was born in India, lived in India for about 2 years, and then moved to US. And I wanted to show that glyphosate is Roundup, which is pesticide, it's an herbicide. So whenever you see American corn, know that it is laced with glyphosate. A lot of genetically modified foods are laced with glyphosate. So he presented with symptoms of autism. And when I did his toxicity profile, he not only had high levels of glyphosate, but he also had high levels of mycotoxins. So this is aspergillus, the black fungus that you see over onions and over building walls and all of that. This is what he had high levels of. And also industrial toxins. And vinyl chloride is one of the main things that is very high in his profile, which actually has been linked with autism. Then the third point that I wanted to draw attention to is the adverse childhood experiences. A study by Vincent Pelletti et al. They have linked adverse childhood events to every disease known to mankind and early death. So basically, what happens with adverse childhood events, there's a phrase, you live fast and you die young. So cellular aging, neurological aging happens when we are exposed to trauma in our childhood. Telomere shortening has been shown with PTSD. So telomeres are those ends of chromosomes which actually, as we age, telomere length goes down, and that is associated with cellular death and apoptosis. And one way to maximize cellular health is to actually keep the telomeres healthy. But when we are exposed to stress, the telomeres go away. Basically, we die one cell at a time because of stress. And then I also wanted to, there's so much that I wanted to talk with in just about 45 minutes. But this is very important. The two basic needs of childhood is attachment and authenticity. Attachment is about for physical survival. Authenticity is for emotional survival. When a child is raised in an authentic manner, when a child is allowed to be who she is, that results in development of healthy sense of self-identity, self-worth, self-compassion, and self-love. When that is not allowed, then the child learns to dissociate from herself. And that dissociation, we can actually, from a psycho-spiritual perspective, we can see that as depression. So let's look at genetics and microbiome. There's always this conversation about is it nature versus nurture. To me, from the experiences and everything that I've had, I think of genes as just a blueprint. It's the building blocks which is provided by the environment that determines the health status of an individual. So this is the whole methylation cycle. Now, I know this itself is probably a whole talk by itself, but basically this MTHFR gene that we see here is a very, very crucial gene for many different functions. So this is responsible for synthesis of 5-methylfolate. And in this circle, this is responsible for synthesis of neurotransmitters. So as you can see, 5-methylfolate is actually implicated in neurotransmitter synthesis. This is the folate cycle. And here in the methionine cycle, 5-methylfolate is responsible for recycling of methionine, which is then used in many different methylation reactions. It is also responsible for converting homocysteine here, which is a very, very toxic molecule, into methionine. And if that doesn't happen, homocysteine accumulates. Homocysteine directly causes arterial inflammation. So arteriosclerosis and atherosclerosis is linked to homocysteine, which is why we see that MTHFR polymorphisms are associated with stroke in the young and heart attacks in the young. But it can also cause MS, autoimmune, every disease. So who would you look for this particular gene? Anyone with any autoimmunity, any mental illness, any heart disease, or especially in the young, and stroke in the young, we have to rule out methylation gene polymorphisms. Genetics versus epigenetics. I believe, based on my learning and experience, that it is epigenetics. And it's also a very hope-inducing way of thinking, because we cannot change our genes, but we can definitely change our epigenetic influences. Food is one big one. So when it comes to the previous slide, which is MTHFR gene, all I have to do for my patients is actually to provide 5-methylfolate, sometimes methionine, sometimes methyl B12. And in doing that, I'm actually enhancing these cellular, intracellular biochemical reactions. And that can actually change their physiological expression. Then what about the microbiome? The human genome, we have millions of genes, but only 26,600 genes are uniquely human. The rest is actually everything in our environment has been incorporated into our genome, especially the genome of our gut microbiome. We are outnumbered 1 to 10 by bacterial cells in the genome. What the microbiome does is that it regulates our immune system, neuropsychiatric system, as well as our metabolic system. It modulates gene expression. In fact, the breast milk for the infant in the first 4 to 6 months of life is for the health of the microbiome. It's not for the baby. That's how important the microbiome is. And it synthesizes GABA and BDNF, brain development factors. So anytime we're thinking about neuroregeneration, we need the microbiome. There's another slide that talks about the connection and the evidence for microbiome implication in the mental illness. Just like we are not happy, the microbiome in our guts is also not happy with what we're doing to them. The chemicals in our food, the stress, everything is destroying them as well. So let's look at intervention. This is all I do in my practice, is that I manage the root of a root cause of the person. Do they need? So in other words, what I'm doing, number one is always healing the gut, gastrointestinal rejuvenation. Number two is immune system rejuvenation, hepatic detoxification, mitochondrial rejuvenation, sometimes hormonal balance and microbiome balance. And how I do this is through food and supplements mainly. So what does this person need to be rid of something? So, and of course I do my evaluations, which includes not only the inflammation markers, thyroid, complete thyroid profile. So just doing TSH, T3, T4 is not going to be helpful. We have to look at TSI, TPO, and globulin as well as TPO antibodies. Because I've seen in my practice, antibodies may be positive, but TSH, T3, and T4 will be negative. They'll all be normal. So it takes, then I understood that from the immune system attack on the thyroid gland to frank hypothyroidism or hypothyroidism, there is actually a huge lag period of at least 1 to 2 decades, so 10 to 20 years. So our intervention should be at this point, not when the gland has been destroyed and a person is in frank hypothyroidism. And then doing that, so many patients are present with depression, anxiety, or even psychosis, as in the previous patient too that I mentioned. Her TSH, T3, T4 were perfectly normal. The only abnormality was with the T3, but she manifested with psychosis, anxiety, OCD. So we think of, it's hypothyroidism that may cause psychiatric diseases. No, it's the immune system that is actually causing all these symptoms. So what we need to thrive is really just food, vitamins, light, water, air, and movement with the meaning, purpose, and love. What we do, we remove the offending foods, we replenish with nutrients, repair the gut lining, and finally re-inoculate the gut bacteria. So I don't start probiotics right away. And based on my evaluation, if I find that they're having gut dysbiosis, which is bacterial overgrowth or fungal overgrowth, then we treat that before we give the gut bacteria. So with patient story 1, it's been 4 years now. It took him about a year or two to achieve complete remission. I did send him to a comprehensive exposure and response therapy program where they wanted to give him Topamax. I don't know why they wanted to give him, but he took it there because he didn't want to argue with the physicians over there. But as soon as he came back to my practice, he couldn't see me while he was doing PRP. He came off of the Topamax, and then he actually got a better job in the banking sector, which is what he's more qualified for, rather than as a Starbucks manager. He was recently married as of August of 2021, and he just got home. He had asthma, allergies. He was also overweight. None of those conditions plagued him. When he's stressed out, he does have a tendency to become a little bit more compulsive and obsessive, but he's learned through meditation. He does Vipassana meditation quite often. He's learned how to manage that. In the second patient, she is also in remission. She describes her OCD as 99% improved. This is her, as you can see, her rosacea is completely gone. She sent me this picture last month. This is just to give you a comparison. This is how she was when she started, and this is how she is today. And in the third patient, the boy that I showed with the toxins, the main thing that I've been giving him is, in terms of, I've been focusing on detoxification for him, but also elimination diet, which eliminates dairy, gluten, corn, soy, and eggs, and also some anti-inflammatory supplements. There's been some significant improvement in hyperactivity, eye contact, receptive language. So he's become more responsive, and he is also making an attempt to express his needs through language. And all of this in just 3 months. So we can end here. The next, I can take some questions. The next one, I really just wanted to, this is even World Health Organization, this is browsing their website. They talk about creating an environment that promotes healthy living and encourages people to adopt a healthy lifestyle. That is the basis for even mental health. And they said that this calls for a multi-sectoral engagement in the life use approach. So the big reason why I wanted to speak here, because you guys are the bastion of mental health here in India. And most of the policies and changes, everything happens here. So this is not, I mean, I'm working as a private clinician. I work with patients on a one-to-one basis. But really for health to change at a population level, it is institutions like these that can create a huge change. As I said, you know, I can take questions. Hyperbaric constant, we can talk about it at a later date.
Interesting. One thing I wanted to check is, say for example, elimination diet. It basically stopping certainty. You also use
No, actually, most of my patients do Panchakarma after one. They do that. But the elimination diet is really probably more coming from functional medicine, also from Ayurveda too. You know, here in India, I know many of my colleagues say that when you start them on a medication, few patients ask, what is the diet? Because that wisdom is there, right? Because we know that diet changes have to happen. But the reason why I eliminate diet, dairy, gluten, corn, soy, and eggs, that comes from more research on functional medicine. These are the 5 categories of foods that are highly inflammatory, especially when our digestive file is low. So the foods themselves are not bad. The foods are good if they are organic and they don't have any chemicals in them. But what happens in any disease is that the number one thing, and Kishore can talk about, we talk about acne is low or there is a disturbance with the digestive file. So to not overstress the digestive file, we eliminate these foods which are difficult to digest. And we recommend a diet program which includes mainly, for me it's clarified butter and bone broth. These are the 2 main things. For vegetarians, I recommend khichdi. Ayurvedic khichdi, not the masala khichdi.
It's not we use after the.
Yeah, for Panchakarma, yes, yeah. So the first 4 to 6 weeks, and this diet is not forever. It is only when we are repairing the gut lining. Once the gut lining repairs, which doesn't take long to do it. When people follow these recommendations, it takes about 4 to 6 weeks. And then I tell them to reintroduce to see whether they are able to tolerate. Most of them are able to tolerate almost everything except for either dairy or wheat. So.
Another thing that a lot of people in India are not talking about is milk, particularly dairy, A1 or A2 or whatever. Depends on those milk, which is the Holstein variety which came from Europe.
A1 is New Jersey, the Jersey cows.
So,
yeah, A2 is our basic cows.
Yeah, so I don't know whether this makes a difference because you're saying dairy, soy, corn we don't use so much here. Dairy is almost universal in India.
But anybody that is, that is well versed, I mean, like, in Ayurveda, when somebody is having colds or coughs or, repeated sinus infections, we recommend staying away from milk because milk is understood as making phlegm. So there is, I think people will be aware. Yeah.
Any questions? If we are online, they can also ask.
Yeah.
Any questions in the chat? There are some questions.
Somebody comes with a allopathic prescription, to ask them to continue or
So we do an analysis as to whether that is helpful for them or not. And then you see, my job is not to force anybody into anything. I make it very clear that there is no dogma here. We just evaluate how any intervention is working for them. But my reputation has been that people do come to me because they don't want to be on psychiatric medication. An average duration of treatment for a patient that comes to my practice is actually about 15 to 20 days. So they've been on chronic antidepressants and other medications and not feeling better. So that's where they come to me. And they all, invariably they're experiencing many side effects.
In terms of legal side of things, so there is some kind of a regulation which was So you said insurance somehow.
Yeah, the malpractice insurance does cover.
What about insurance for patients? Can they get money for this?
Not at this point.
No.
Shivram, can I say something? Shivram?
Yes, madam.
Shobha Srinath here.
Yes, madam.
Namaste, madam.
Hi,
Hi, how are you?
I'm fine. Nice to see you, Aruna. I remember long ago, you told me you were going up this path and I see you have arrived. And I can see from what you say that you're very passionate about it. And I see a lot of change in what you say your patients do. And I quite agree. There's a lot of what we can use from what you say. Thank you. It was lovely listening to you. Thank you,
so
Shivram.
Thanks, madam. I thought it was you, but I couldn't see you. Now I can.
Okay. Thank you.
Thank you so much. That means a lot.
Thank you.
Yeah. So anybody from the Ayurveda want to ask questions?
Madam, I would, first of all, I would like to congratulate you, madam, from the modern stream. You were open enough and you explored your ideas and you took this path. So it's really wonderful. And I learned a lot from your speech. Now, when you say about lifestyle, the recommendation regarding their daily routine, say the biorhythms, what time they should get up, what time they should sleep, daytime sleep, and all those things. Do you cover that also, and what is your approach?
So that is straight out of Ayurvedic literature. So so my patients, I use a electronic health record system, so they get a very comprehensive list of recommendations. One of them is about how they should, when they should wake up. And I do talk to them about the different times when Vata is more, Pitta is more, and Kapha, and why you should wake up at a certain time. How to, when is a good time to exercise. For Vata people, and there, everybody's running. And Vata, actually, too much of running increases Vata imbalance. And two patients recently I've seen developing arrhythmias. They're lifelong runners, and in their 50s, they suddenly developed arrhythmias. And they went to their primary care physician. They didn't have an idea about that as to why that is, but they know that running excessively causes arrhythmias. They don't have an understanding of that. But when this patient came and told me, I'm like, oh, that sounds like a Vata imbalance. So they're, so we do modulate with regard to this in terms of exercise as well. So once we understand what their doshic imbalances, we do try to recommend what kind of exercise. Meditation is big, and then I have not touched upon it, but a big part of what I do, whether it is anxiety or schizophrenia, as soon as people are out of psychosis, I do work on their self-identity through psychotherapy. So, what I talked about in terms of adverse childhood events, that loss of authenticity, that gives rise to the dissociation from self. So I work with them one-on-one in psychotherapy to get them to accept themselves exactly how they are, with compassion and develop self-love. And so that's a very psycho-spiritual process that happens. But the roots of that is also, for me, it is informed from what I've learned in
Another question I had, madam, was when you prescribe certain dietary modification to patients, say having khichdi or the simple food items, especially those who have psychiatric illnesses, it may be difficult.
Yes.
How do you ensure compliance adherence to such lifestyle modification?
So for depression, patients that are not psychotic, it is actually, they are very motivated. Again, it's a self-selected population, I must accept that. Patients come to see me, their insurance is not covering the pay out of pocket, but they're desperate enough to try new things. And then with the intervention that we do, both the combination of Ayurvedic supplements and functional medicine supplements, plus the diet change, within 3 to 4 weeks, they actually do feel better. Their energy is better, they're sleeping better, the brain fog is gone. So they know that this is working. So from then on, it becomes easy. But I do have a wellness coach. So that, again, that comes from functional medicine. In functional medicine, they do recommend having a wellness coach. So I have a wellness coach who is trained in functional medicine. So she will work on motivation and answer. But in patient, I have one patient with schizophrenia. His mom actually was able to change his diet. And I see this with very hardcore schizophrenia patients. This patient, he was an African-American gentleman. For 6 to 7 years, he had been very psychotic, in and out of hospitals, severe thought disorder, not even able to engage with me when I first saw him. And he had just been discharged from a hospital. He was prescribed olanzapine and something else. The mom, so I did most of my education and intervention with the mom. He was living at home with her. She completely changed his diet. And I told her, I'm not doing psychotherapy, don't come back to me for at least 2 to 3 months. After 3 months, she asked for an appointment because he was actually doing that. His delusions, hallucinations, his aggressive behavior, everything had come down. And then there's a fast food chain called Culver's in my state. So she said that every time on occasion he would go out and buy from Culver's, he would end up for 2 or 3 days becoming delusional and having hallucinations. It's very, very dramatic actually. And so this young man, for 6 years, he was not working, just staying at home. But after this treatment, after 3 or 4 months, with mainly Ayurvedic supplements, nutrition supplements, and diet change, he went out one day and got a job at a fast food center. He was doing well for another 3 months. And then, he began to then eat more at that fast food joint, and also the people that he was with, they were drinking alcohol. Then he relapsed with alcoholism, and then he was once again experiencing psychosis. So there is, this is a problem, but at least the science is there. So yeah.
The first one is something about the verb. Then the first question I got.
Yeah, the fasting and mental illness, I'm not aware of that.
Yeah, there is some work on intermittent fasting. Of course, on immune function.
Yeah.
A lot of
Immune function, yeah, intermittent fasting, and it actually, I think it reduces cellular region.
exactly.
That,
I don't know whether directly on mental illness, whether there is any work. First one, I think, is more of a question on somebody referring to getting anxiety or gets acidity flare along with intense coughing whenever there is anxiety. Because whether a better diet plan help.
absolutely. Yeah, in fact, that coughing is because of acid reflux affecting the lymphatic system. Yeah, we see that quite often too. Yeah, and that acid reflux can actually manifest as panic attacks as well. So that's what I'm saying. If you just, the MSQ that I do, if you do a proper review of systems and if you actually trace the onset, don't just look at psychiatric symptoms, but say, how was your childhood? What medical symptoms did you have at that point in time? You will invariably find gastrointestinal symptoms, predating by almost many years, psychiatric symptoms.
This is from Aditi. She is one of our scientists who basically did a PhD on yoga for depression. A PhD. But what she's asking is, how long do people continue this new lifestyle? Do they need to come back regularly for therapy, or just a teaching?
So the way I explain even to my patients is that the first step is to actually heal the physical body, which is the gastrointestinal hormonal immune system. This takes about anywhere between 3 to 6 months, maybe longer if you're older. The younger you are, the faster your body will respond. Then starts the work of psychotherapy. So healing the mind, especially with that concept of self-love and self-acceptance, that takes at least a year's time. So the elimination diet is only for, depending on the disease, it can be anywhere from 6 weeks to up to 6 months. So anybody with thyroid autoimmunity, they have to eliminate dairy and gluten for at least a year or two. That's just how. It doesn't mean that they have to be 100%. They can, people go back to consuming these foods in small amounts. And then the other thing that we teach people is self-awareness. Your awareness of how your body is and how your mind is. So these are all the techniques that we teach them early on. So I tell my patients very early in treatment with me, check in with yourself. How are your ankles feeling? How is your gut feeling? What kind of thoughts are you having at different points in a day, just check in with themselves. That self-awareness will help them to figure out what is helping them, and what food is agreeing with them and what food is not. And then it's a matter of, deciding, whether it is worth it. Sometimes you may decide, alcohol is a very common thing. In fact, having this kind of an approach, when patients are open to it, I have patients with marijuana addiction who give up marijuana because they are able to make that decision that it is not healthy. Alcohol addiction is the same. But it really, that's why the therapeutic relationship is so important.
Gluten. In America, all foods are labeled.
Yeah.
Here, I don't think that's everywhere. So, say if you are to eliminate gluten, actually how explain what is the gluten?
So the first thing is that we teach them how to cook. Many people don't know how to cook. So that's where our wellness programs are handled. So we do tell them that eating out should be as minimal as possible. There are good restaurants, but they tend to be expensive. We have organic farm to table restaurants, but it tends to get expensive. So we have to learn to take care of our system. Anna is what makes our physical body.
Last question. What is your approach for sleep? There are sleep disturbances.
Sleep disturbances, actually high dose fish oil. So as part of the functional medicine supplements, I give everyone high dose fish oil. So what do I mean by that? So fish oil has two components, EPA and DHA. EPA alone, studies have shown that if you give 2,000 to 3,000 milligrams of EPA, that will actually calm the nervous system, and it is also essential for healing the gut. So simply, like I have, he's no longer in practice. He's recovered and it's fine. He presented as a 10-year-old boy with severe anxiety and fragmented sleep. And this family was referred by somebody, the dad especially did not have any faith in what I was doing. But they came along because they didn't want to start the kid on medications. He was in therapy for almost 2 years, and it wasn't helping. So I gave him high dose fish oil. Almost with the second or third dose, he was sleeping like a baby. So a week later, they had called and said, even if you don't do anything for us, just because he's sleeping through the night, I trust what you're doing. And this kid, he recovered beautifully 3 months. I probably saw him for 3 to 6 months. Children, they recover very, 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 very good.
It's now available as supplement.
So I use a company called Pharmacological supplements. They are really a good company. So my patients are taking 5 to 6 capsules of fish oil. 7 C's, yeah. But I tried looking here because I don't know how much of EPA is there.
But I did
I have one question. Firstly, it was a very intense and bright session. Thank you. So I would like to know what is your experience with oral Ayurveda medication and psychotics? You've spoken about diet and lifestyle, of course, but what about the medications?
So anything with heavy metals we are not allowed to use. So we don't even go there. But that's where even by simply managing the GI system. So we do use Triphala, we use Abhipatika, we use different arishtams, Jeevaka arishtam, Ramasha arishtam, for restoring the digestive. So that patient with schizophrenia, I think he was an Abhipatika and Jeevaka arishtam. So so we don't use, I think what is it, Manas Mitra and Saraswati arishtam. So this Indian boy, his parents have access to medicines here. They are willing to try the Saraswati arishtam and Saraswati rhythm, but otherwise I don't recommend it. So don't have much of experience. So that's why I was telling Dr. Shivram, my knowledge of Ayurveda is probably just at the surface. But even with that, we do see significant changes. That's where food is less.
This lady who works with the Ayurveda doctor. So is she considered as a medical practitioner with American medicine? No.
But we have Ayurveda is really becoming very popular. There are 2 organizations, Apna and Nama. Those 2 organizations are actually trying to regulate and provide some legitimacy. So she is registered as a Ayurvedic doctor with both these organizations.
Is a daily consultation legal now there?
Yeah, I mean, COVID changed. Yeah.
Because here there is quite a, the government released a very clear guideline for Ayurveda. What can be prescribed and what cannot be prescribed over here. Obviously, the associations can be prescribed. Most of the others I think can be. The one issue which is happening here is cannabinoid or cannabis related products. Ayurveda doctor can prescribe. Allopathy doctor cannot. So there are who are prescribing cannabis related products as medicine. Then people get addicted and all this stuff goes on. So what about that? Cannabis is legal in some states.
It is becoming legal. I mean, there was two things. There's THC, which is the addictive one, and then there is CBD, which has the anti-anxiety.
CBD is available there.
CBD is legal in all.
That's what you're saying. Here there is no THC. It's always in
THC. There we do get pure CBD. I mean, some of my patients use it. I don't know. I think I've found mixed responses to it.
Because you know, Sadhnik is doing quite a lot of work on CBD.
No,
In UK. So he's one of the people who are really working on CBD and psychosis. He has found
CBD for psychosis.
So he has done quite a bit of working in UK. He actually came here and then wanted to sort of set up shop here and work with what he wants to do.
To answer your question, most patients are in treatment with me for about 2 years, maybe 3 years. And then after that, so the first year is all about healing the mind and body. Mainly the body, and then we start healing the mind. The second year is really transitioning into regular life. So there is where patients learn how to live their life according to their own health status. What agrees with them, what doesn't agree with them. That's what we all have to do. And self-awareness is very important.
Gandhi basically asking fasting and fasting. Talking about that. Any thoughts that you want to incorporate into that? That you work more with nutrition.
So intermittent fasting, I do talk about that with patients. Purging we don't do. That's actually not allowed. So we don't do that's Virechika. So we don't do Virechika. So in Panchakarma we are doing basically Nasya.
Not allowed.
So there.
But similar than any actually in sense.
No, I mean, it maybe, but a lot of it's also guided by customer. So, throwing up is. It's not accepted.
Okay.
So, interesting. Could you be able to look at the epigenetic changes in the gut before and after the diet? I mean, okay. I mean, epigenetics would be in terms of phenotypic expression. So somebody coming in with, say, symptoms of IBS, yeah, they do recover. So their bowel movements become regular. They don't have bloating. They don't have.
I think what is asking is, have you tried to look at study of microbiome or whatever before and after? That's what I think.
I mean, the way I understand epigenetic changes of phenotypic expression. Or okay. No, we don't. I am first and foremost a clinician, but a keen observer. So I don't do any research.
We have some yes, now we want to do that because we have asked for a center of excellence. But as part of that, we actually want to do microbiome. But usually you will be the sample.
Yes. Yeah, in fact, I don't, there are many tests where we can actually look for gut microbial disturbance. Actually, stool test and breath test, all of those things are there, but they're all, none of it is paid by insurance, and that's not covered. So a really good indicator for me is my nose. I can actually smell fungal dysbiosis. It's I can, and then the proof is in the pudding. And I tell patients that you have fungal dysbiosis, I can smell it in your breath. If you trust me, take these herbal anti-fungals, and then we'll see how your response is. And so I do that as well. So a lot is really about clinical observation.
You actually run some genetic tests.
Yeah, all my patients I do contagion. Anybody with autoimmune disease,
That's
cancer.
easily available there.
Yeah. So I do it with 23andMe. Yeah.
Right.
I think I've heard even here some genomic, MTHFR gene is coming up. Any autoimmunity, any mental illness, any cancer, we should be looking at methylation gene profiles.
I don't know in the US, but in India now,
There too. Yeah, so I see that quite a lot. So that's why, so my baseline panel in terms of nutrition includes vitamin D, B12, and then I also see, unfortunately, I see a lot of iron deficiency in teen girls and young. So, because what's really happening is that our gut lining is getting disrupted. So not only is there inflammation, the converse of that is that there is malabsorption.
Yes. Here, many of the people who are very non-vegetarian are getting severe B12. Quite remarkable because there's so much of B12 in what they're eating.
Yes.
Like you say.
But it's also about malabsorption. And then when you're stressed, I went over very fast over these slides, but when you're stressed, your adrenals, they suck up the B vitamins, all the B vitamins, and D as well as iron. Adrenals need all of that to function. So that's why when you're stressed, that's why pregnancy and postpartum, we see need for high amounts of complex nutrients.
Is there any comments?
She's been getting a dose of what we have.
All right. So I think that you said that you can go into it this time, but then that's a separate topic altogether.
Yeah, I will share. I mean, I shared it with you. You can share my
Maybe we
slides.
can sometime later have another online session from there. So we can discuss. COVID has made us change in a big way. Do a lot of teleconsultations also. Of course, Nimhans is restricted to follow fresh outside. Now,
No, I mean, that's whole another topic.
but at least for this it is good.
Yes.
Interacting in this kind of things. So thank you very much. We are very
It's my
happy to have you here. I understand that you went to some hyperbaric oxygen therapy conference and then came here, right?
No, that's actually, it was supposed to be in January, but in Mexico, but there are 2 gang shootings there, so they postponed it to March now. So. No, I didn't want to die anytime soon. So you can't use Ayurveda for that.
No. Thank you very much. I think you had a very nice time and we will keep in touch.
Yes.
And really, I think your case reports at least you should publish.
I see again, I'm a lone woman there. Yeah.
You are in the right place because passport industry of the world is here. So,
No, what I'm saying, see, I mean, I'm getting to the point where I need a team. That's what I'm doing.
correct.
We'll see how.
You're always welcome to come back.